Hi, my name is Steve Matai, and I'm an associate professor of medicine at Johns Hopkins University School of Medicine. I'm part of the pulmonary hypertension program there. Treatment for pulmonary hypertension in the setting of connective tissue disease is similar to treatment of pulmonary hypertension in patients who do not have connective tissue disease. If you have pulmonary arterial hypertension, initial therapy should be based upon your risk stratification. So risk scores are used commonly in clinical practice to determine your risk of having more progressive disease and worse outcomes at the time of diagnosis. Based upon that score, treatment decisions can be made regarding whether one therapy is indicated over another or whether combination of therapies are recommended. It's important to note that while previously we thought that patients with connective tissue disease associated pulmonary hypertension may not respond as robustly to medical therapy as patients with other forms of pulmonary hypertension, more recent data has suggested that certain strategies might be associated with improved outcomes in patients with connective tissue disease and pulmonary hypertension. This will be very important for you to discuss with your providers to determine the optimal treatment strategy for you as an individual. Of concern when you have underlying connective tissue disease is whether medications used to treat connective tissue disease might either interfere with treatments for pulmonary hypertension or perhaps be less effective in the setting of pulmonary hypertension. This does require some conversation with your providers to understand the potential for interactions between medications that you are on, and importantly, the indications for medications to treat your underlying connective tissue disease and your pulmonary hypertension. Many of the medications used to treat pulmonary hypertension in the setting of connective tissue disease can cause problems that might be more profound in patients with connective tissue disease. For instance, many medications used to treat pulmonary hypertension can cause an upset stomach and gastroesophageal reflux. This is already a problem in most patients with connective tissue disease, specifically those with scleroderma. So it's possible that treating a pulmonary hypertension might worsen this symptom. These are some of the considerations that should be evaluated when making treatment decisions for patients with scleroderma or other connective tissue diseases and pulmonary hypertension. It's important when undergoing an evaluation for pulmonary hypertension that connective tissue disease is thoroughly evaluated and excluded. If connective tissue disease is suspected based upon your symptoms, your physical exam findings, or blood work, it's important to get a proper and accurate diagnosis of the underlying connective tissue disease. As we discussed, patients with scleroderma are at higher risk for pulmonary hypertension than patients with other forms of connective tissue disease. So getting an accurate diagnosis regarding your connective tissue disease really helps inform what we should do going forward to assess your risk and the risk of development of pulmonary hypertension.